Okay. Good morning. Happy Friday. Happy Good Friday. This is episode 10 of When Is It About the Patient? And today we have with us Julie Grasson from CareNet, and we're going to talk about the people who kind of fall between the cracks in the system. They're uninsured for whatever reason. So with that being started, Julie, this isn't on the list, but I just thought of it. How are patients directed to you?
Generally speaking, patients find us either by going to a free or charitable clinic, an FQHC, and even through the emergency rooms.
Julie, tell us what FQHC means for people that don't know healthcare acronym.
I'm so sorry. FQHC is the Federally Qualified Healthcare Clinic.
Thank you. So why don't you just tell us about Lucas County CareNet and then who the target audience is for CareNet?
Sure. So CareNet started over 20 years ago when our mayor, Jack Ford at the time, reached out to both Mercy and ProMedica and said we really need to address the needs of our community's uninsured. And within a very short time span of less than 9 months, CareNet became its own 501c3 and began serving patients. So the whole concept behind CareNet when it was initially founded was to identify individuals that were low income. So those that had a household income below 200% of the federal poverty guidelines and not eligible for any other form of coverage, whether it was Medicare, Medicaid, and employer-sponsored coverage. And once these individuals were identified, they were connected to a primary care or a medical home. And then thanks to our partners with all of the hospitals here in Lucas County, they then received hospital-based services at no cost. And we have over 200 volunteer specialty physicians that see our members at no cost. And so in our biggest heyday in 2012, right before Affordable Care Act and Medicaid expansion, we had over 10,000 active members. And so in those first 10 years rather, it was discovered with no real shock to anybody that by connecting people to preventative care, it significantly reduced the number of ER visits and the number of inpatient days.
Which
Gee.
is really important for hospitals.
Oh, definitely. That doesn't surprise me at all. So, Julie, another question. When we talk about people with unmet social needs, who are we referencing there?
Truly anybody. So oftentimes individuals that may not be truly considered low income based on the federal poverty guidelines, but who are living paycheck to paycheck, when there's a disruption in that income, they don't generally know how to access services. And so in 2015, 2 years after the Affordable Care Act went into place, CareNet became a care coordination agency working through the Northwest Ohio Pathways Hub. And with that, we have community health workers, oftentimes referred to as CHWs. And they meet with their participants at least once a month. They do a deep dive into what their barriers are to care, really looking at the social determinants of health. And when those barriers are identified, the CHW is helping connect them to the various services.
Gotcha.
So more than just healthcare sometimes, right, Julie?
Oh, most often it is more than just healthcare. If somebody's in crisis because they've run out of diapers or they just got an electric shutoff notice, healthcare is the least thing on their mind. So crisis things need to be addressed immediately in order then for the individual to start addressing some health concerns. Because if you don't have a place to live, who cares if you made it to the family doctor for an annual physical or, to get your annual mammogram?
Oh,
Right.
exactly. And if you're just chugging along, living paycheck to paycheck and everything's good and then that's cut off, you're right. You don't know what services are out there. How would you? Why would you?
Exactly. And so that's what the community health workers do, whether it's connecting somebody to the diaper bank, helping somebody apply for SNAP benefits so that they have a little bit more easier access to healthier foods. It could be helping someone find a list of food pantries.
Gotcha.
I'm just thinking about it when someone's uninsured now with, like you were talking about, the Affordable Care Act and Medicaid expansion, that number's gone down quite a bit. Do you first try to get someone to Medicaid or something like that if it's not an immediate need, like they need the medical, treatment right now, almost in an emergent situation? Do you try to get them connected to Medicaid first
So,
or no?
yeah, so almost all of our primary care clinics that partner with us, as well as all of the hospitals, have the ability to do presumptive eligibility for Medicaid. And with that, it then provides the Medicaid coverage for that emergent service, as well as for the next 30 days. The downside with this form of Medicaid is that oftentimes the patient is then required to submit additional documentation to Job and Family Services. And if they fail to do that, they then lose their Medicaid coverage, which means that down the road, they could potentially qualify for another presumptive eligibility, but they can't keep relying on presumptive eligibility because after so many attempts, they don't qualify. They would have to wait another, I believe it's 12 months. But so community health workers can help people to ensure that they get that coverage, the presumptive coverage that leads to full Medicaid. And then CareNet also has navigators that can help with that.
So Julie, correct me if I'm wrong. And I'm pretty sure this is one of the clinics, the FQHC clinics. There's a clinic over there on, I believe is it on Franklin?
So that's a Mercy clinic.
Right. So
Yeah.
if I show up there and I make an appointment, I show up there, they determine I need a surgery. Walk me through what they will do for me. Do I
Um,
have to show proof of income or lack of income? What do I need to qualify?
So each of the clinics will, when somebody makes a new patient appointment, the majority of the clinics do attempt to help that individual with signing up for either Medicaid or referring them to us for the Navigator program, which will help them with a marketplace plan. If that person is not eligible, maybe they're an undocumented individual living here, the clinic gives them a CareNet application. They will still see the patient that day. And then we at CareNet get them enrolled into the program. And pretty much it's a one-page application, and we're not talking anything extensive. Looking for proof of income and a photo ID just to verify that they are who they say they are. And we get them enrolled. And then as their treatment plan progresses, primary care will then send our office a referral for general surgery or cardiology or whatever it may be. And then we work with our volunteer physicians to coordinate an appointment within their office. And, the ball will keep rolling depending on what those additional needs are.
So once that's initiated, then a lot of the information that's needed is basically up to the patient to be somewhat compliant and make sure that the clinics get the documentation that they needed, correct?
Exactly. There is some onus on them, but CareNet's there to help. So, maybe they don't know how to get a photo ID or a state ID. Maybe they don't have proof of income, but we're there to help them and guide them through those steps as the best that we can. They just need to reach out to us.
So the next question that comes to my mind, Julie, is I know of some of the FQHC clinics in the city, more or less, but what if I'm that patient that I'm living out, we'll just say in Swanton, because that's part of Lucas County also. How many clinics are there? Is access an issue?
So right now we partner with 15 different clinics. The majority of them are here right in Toledo, but like Neighborhood Health Association has a clinic out in Holland, which, is a little bit easier access for someone that may be in Swanton. The other nice thing is, and this came about in the I'd say right around 2005, 2010, where if an individual was already connected to a private practice family doctor and for whatever reason lost their healthcare coverage and maybe they weren't eligible for Medicaid or anything and became enrolled in CareNet, those primary care docs were still seeing the CareNet member, and it may not have been at a free rate like many of the clinics, but it was at a self-pay rate. So, and that was something that was predetermined with that primary care office, but then we were still able to enroll the individual into CareNet. And so as long as primary care provider is willing to work with the patient for that, we're able to, still enroll them into the program.
Gotcha. Yeah, I know from firsthand experience, primary care will, if let's say you started out, you had a job, you had commercial insurance, and now you're unemployed and you don't have insurance, and whatever reason you don't qualify for Medicaid, they do continue to see those patients. Those are their patients, and they continue to see them. And just because they've fallen on some hard times, they don't abandon them. I think the trickier part is getting a patient in somewhere when they don't have insurance.
Absolutely. And unfortunately, that's where we want to connect with individuals because it becomes such a burden on the emergency rooms to have individuals that are showing up there for things that truly can be addressed with a primary care doc. Showing up at an emergency room because you have a sinus headache or a sinus infection. That's not the best use of our community resources.
Oh, absolutely not. And that is an issue with emergency medicine. When patients show up for things, it's poor utilization of the emergency room resources, and because they're really there for emergent care, and your sinus headache is not an emergency.
Exactly. And so that's the other nice component of CareNet is the Navigator program. So maybe you do have somebody, who's now over income for Medicaid, but doesn't have employer sponsored coverage, or somebody that lost their job. Unemployment is still too high for Medicaid. CareNet has Navigator. They're certified through CMS, licensed through the Ohio Department of Insurance, and they'll sit down with individuals and help them with a marketplace application, help them look at all of the plans in detail to determine which plan includes the doctors they're already seeing, which plans include the medications they're already taking, so that people are making informed decisions. And for a lot of individuals, we're seeing plans through the federal marketplace that are 10, 15, 20 bucks a month for their monthly premium, which is way more affordable than any Cobra plan I've ever seen, and definitely more doable for a household budget than all of those uninsured patient bills that they could potentially end up getting from an emergency room or a family doctor or labs or whatever.
Exactly.
Julie, how does someone qualify? You mentioned for CareNet. You mentioned income. Is there a specific income guideline that you guys are looking for, or?
So in terms of the traditional CareNet, that Charity Care Network, for those that don't qualify for Medicaid Marketplace, Medicare, it is 200% or below of the federal poverty guidelines. Those are dollars amounts based on household size that the federal government releases. Generally, every January or February, the federal government updates those. Let's see here. So right now, for a household of one, if the individual is making less than $27,000 a year, they would qualify for CareNet. And so the way we determine household size is if the individual files a tax return, or if they would file a tax return, who is counted in that return as either a spouse or a dependent. So if it's a married couple with 3 kids that are under the age of 18 and they claim all 3 kids, that's a household of 5.
Right. Yep. And the income's adjusted accordingly to those 2.5 versus the 27,000 for a household of 1. So
Yeah, absolutely. So a household of 5, the income can go up to 64,000.
right.
So if you're married and have 3 children and you are uninsured, you can make up to 64,000 and still qualify for free care.
As long as you're not eligible for Marketplace or Medicaid, correct? Because as soon as you're eligible for one of those other healthcare coverage programs, CareNet helps you get enrolled in those. This is truly a charity care network for those that truly fall through the cracks and do not have access to any other form of coverage.
So if they qualify for Medicaid or something in the Marketplace, then that drops them off of the CareNet eligibility.
Correct.
Gotcha. So then I'm assuming, and it's never good to assume, they say, so if I qualify and I'm just gonna say I'm at my doctor's office and they're going to connect me with CareNet, whoever the office contacts, then they get back to me or they follow up with me, they hook me up with a navigator.
So if you go to a primary care clinic and you tell them you're uninsured,
Mhm.
that primary care clinic should be, first of all, looking to see if you do qualify for Medicaid. If you don't qualify for Medicaid, they will put you on their sliding fee program, but they should also be giving you a CareNet application and referring you to CareNet. So if the individual completes the CareNet application, they can get enrolled in CareNet. And then how do I want to word this? If they're not eligible for Medicaid, but are likely eligible for Marketplace, that referral to CareNet is our to reaching out to them and connecting them with one of our navigators for a marketplace plan.
You know, Julie, you just made me think of another probably barrier that is a challenge for you on your end, because I know from my own personal experience, and especially now since the pandemic, staffing is an issue in many offices. I mean, that they don't have enough help, they can't find help, they can't hire anybody, and consequently, they also have turnover. So, with all that being said, you guys are really reliant on the office being adequately educated to speak to these situations when they come up with patients. And all of this is making my blood pressure rise because I know how that goes. So I can see where that could be a barrier.
Definitely throughout the pandemic, it was a barrier because unfortunately, and I think everybody saw this, there was such a rapid turnover in staffing. My experience thus far is that has really settled down. And so we at CareNet have been working very hard to reconnect with primary care clinics that are partners within CareNet to do that education with their team. You know, and unfortunately, there still are instances where individuals may fall through even that crack. But we encourage them to reach out to us, and we're more than happy to then reconnect with the clinic to ensure that that individual is an active patient there. And we'll work with them, you know, to do the CareNet application, to do the Medicaid, whatever it is that they need.
Yeah, because when you're constantly training new staff, there's so many things that you have to educate them on and things that they have to remember. I can see this being one of the things that are like not at the top of the list that you want them to have in their daily repertoire of what they converse with patients about. And it's just something that comes up. And if you encounter someone who doesn't know how to navigate that, or maybe forward that call to the manager who does know how, or someone who knows how. Some offices do have care navigators in their offices who could probably help too, but I can see how this could be a problem.
You know, and even through the work that we do with navigators, we have some primary care clinics or primary care offices that allow us to have displays set up that basically say, are you uninsured? Do you need help getting healthcare coverage? And, you know, reach out to CareNet. Here's an 800 number, because our navigators are even able to work with people and assist them over Zoom, over a phone call, or meet with them in person. Whatever is the easiest for that individual, our navigators will do.
Gotcha.
Since we're talking about navigators, why don't you explain what a navigator is and exactly what they do and how they help the patient? I know we've talked about them helping the patient, but maybe a little bit more detail of exactly what the job description of a navigator, so people understand what a navigator is.
Sure. So, thanks to federal funding that the Ohio Association of Food Banks has, they then partner with multiple organizations throughout the state. CareNet covers 21 counties in Northwest Ohio with a licensed and certified navigator. And so I think I mentioned just a little bit ago that they get certified through CMS, and it's an online course or series of curriculums that they complete. They must, you know, pass tests at the end of each module to verify that they understand the information and the content. Once they've done that, they then become licensed through the Ohio Department of Insurance. So these are not individuals that are fly by the seat of their pants and, you know, winging it as they're trying to provide assistance. The big precautionary that I would just love every individual out there to keep in the back of their mind is that if you Google marketplace insurance, you Google Obamacare, you get all sorts of things, and there's organizations, companies out there that pay to have their link show up first. The downside with that is you don't know who you're getting when you reach out to somebody that way. Individuals, if you literally go to healthcare.gov, that is the official website for anything marketplace. Through healthcare.gov, there is a tab on there that individuals can click to find local help. But here in Ohio, we have a toll-free number that will get people connected to a navigator in their area who is licensed by CMS, certified by CMS and licensed by Ohio Department of Insurance. The navigators sit down with individuals, help them determine if they may be eligible for Medicaid or Marketplace. If it's most likely a Medicaid application, we're going to help you with that Medicaid application directly through Ohio Department of Medicaid. If you are clearly over income, we're going to go directly through healthcare.gov, help you create an account, enter all of the information so that the individual can see what they may qualify for with regards to tax credits and cost sharing discounts. Once all of that has been determined by healthcare.gov, the navigator sits with the individual, helps them determine which plans include their doctors, which plans include their medications, and really provides the education. So a couple years ago, there were individuals down in Hancock County that were picking a marketplace plan based on the actual cost. Those individuals, unfortunately, did not have the education or the knowledge that they should have gone in and done a deeper dive. So there was a very large group of individuals that picked a plan that no hospital in Hancock County accepted. So those individuals, if they needed hospital-based services, had to drive to Allen County in order to use their insurance. And so navigators help avoid that. Oftentimes people are picking plans, like I said, just based on the cost. But navigators have the ability to have personal discussions with people, see what their healthcare needs are right now, and evaluate whether a bronze plan, which generally has a much lower monthly premium but higher deductibles, is better than a silver plan. And silver plans are generally middle of the road for individuals below 250% of the poverty line that pick a silver level plan. Not only do they get the tax credits, but they also get cost sharing reduction. And so navigators are just able to really educate the individuals they're meeting with.
So Julie, with all that being said, I'm curious to know if with Obamacare coming into play when it did, what did that do to the numbers for the people who actually need CareNet services?
Yeah, so great question. When Affordable Care Act and Medicaid expansion went into effect in 2013, CareNet had over 10,000 active members. And many of these individuals were, low income. And so Medicaid expansion allows for individuals with a household income up to 138% to qualify. And so with that, our population went down to, on average, about 800 a year.
Wow.
Yeah, so huge difference. So CareNet was certainly filling the cracks and the needs in our community prior to Affordable Care Act. But then for many of our former members, this was their first experience with true healthcare insurance. And we discovered they didn't know how to fully navigate the world of health insurance or health coverage. And so that's why in 2015, we became a care coordination agency and started bringing on our CHWs.
Well, it sounds like the CHWs are worth their weight in gold. And our healthcare system, for anyone, it's not easy.
No, it's very complex.
We don't make it easy.
No.
I mean,
None of it's easy. The one thing that I've never understood is for individuals if they've applied for Medicaid and they get their award letter, on the very front page, it says if you want to appeal this decision. And it's like, who's going to appeal the decision that they were approved for Medicaid? But it's not user friendly. It's not reader friendly. And so the navigators and the CHWs just provide such a valuable service, to our community members.
exactly. We should have applied the KISS principle to this.
Keep it
Yeah.
simple.
Keep it simple, but that hasn't happened. And you know what? Even sometimes Carrie and I can attest, you work in healthcare for many years, and you would think we should know how to navigate a health system, and we might know more than the average person, but there are still things that come up where you're like, it's a scratch your head moment of, well, what do I do here?
Yeah.
100%. And so for those of us that work in this world, we have the added benefit of at least having contacts that can help explain things, walk us through those things, where our neighbors most likely don't. And so any added assistance that we can provide to them is just so valuable. Because the last thing that CareNet wants to see, and I would think almost everybody else, is for somebody to just be like, I don't know what to do, so I'm done. Or how oftentimes are people told, go here, call this number, but, they go to that place only to be told, well, you need an appointment, or you should have brought these documents, we can't help you. Or they call somewhere, they don't get an answer, they leave a message, nobody responds. And I get where it's frustrating because I myself have said, I'm done. I can't do this anymore. But so oftentimes that impacts then their overall health and their health outcomes. And so through CareNet and our CHW, we're hoping to really address those issues for our lower income neighbors who really need that added help and who may be truly living in crisis.
I don't
Julie, oh, so-
I don't know if Compassion Healthcare is one of your FQHCs, Julie, but I
They
know,
are.
yeah, I know Anne Roosh, one of her goals is to try and combat all those things right at the office.
Yep.
Like, oh, you need a birth certificate? She goes, I can't tell you how many birth certificates we bought. It's the little things.
Oh, absolutely. And so many, those little things that impact the overall health, because there's a lot of hospitals, doctors' offices that won't see you if you don't have a photo ID. Well, I can't get a photo ID if I don't have a birth certificate and another form of identity. So it's, how often are people like, I don't know what to do? Maybe I wasn't born here in Lucas County. Maybe I was born in another state. And, getting to where I was born is a barrier. I don't have access to the internet, or maybe I have access to the internet, but I sure don't have the financial resources to go online and order that birth certificate. It's a major trickle down effect, or snowball effect rather, of just meeting those basic needs to improve health outcomes and all the bigger picture of the person.
With that, Julie, speaking of people that may not have come from even our country, do you offer services in another language to help those individuals that are in need but struggle with the whole communication barrier?
Yeah, so we are super fortunate. Within our Navigator program, we have two bilingual gentlemen, Henry, who's bilingual in Spanish, and Abdallah, who is bilingual in Arabic. So they are providing targeted outreach to those populations to help ensure that they have access to coverage. And I'm super excited that we just hired Gloria, who is bilingual and in Spanish and is our newest community health worker because that's a huge need here in Lucas County. So oftentimes people want to receive education and services from somebody that looks like them, sounds like them, and speaks their language. I get it.
Yes.
Exactly. Well, it sounds like you guys are doing as much as humanly possible to connect people and get people where they need to go. I know when you're dealing with people, it's always a challenge. Is there anything else that CareNet does that we should talk about?
Well, those are our three pillars. The Charity Care Network for those that truly aren't eligible for any other services, our community health workers, and then our navigators. But we're always looking for additional organizations that we can partner with. So, if there's an organization that is serving a specific population and they need navigators there to help their clients, their patients, however they categorize those individuals, reach out. We're more than happy to be that community partner. Same thing with the world of CHW. There's a lot of organizations that have community health workers and, Dr. Rush's clinic, Compassion Health, they have several amazing community health workers.
She just opened another clinic.
I know, and it's beautiful. So, but yeah, there is such a large need in our community that the likelihood of any one organization being able to truly meet all of the needs is pretty gosh darn slim. And so if there's a way that CareNet can be of assistance, we're all about that. We truly want to be an extension of those organization missions and values and goals.
And Julie, you guys just did a relaunch this week at the downtown library. Do you want to tell us what that was about? Probably, ever since the pandemic, we have to be reminded of resources we have because we've been shut up in our houses so bad we're not sure where to go for things. So maybe you could share a little bit about that and then also give us the 1-800 number you talked about. And then maybe, Chris, we could link their website as well as put the 1-800 number.
Yeah.
But if you don't mind sharing your relaunch, what happened with the relaunch?
Yeah, so just like you said, since the pandemic and, Chris touched on this earlier, the rapid change in staffing at different organizations, this was just our way of inviting community members, existing partners, potential new partners to the table to really share CareNet's history, share some of our outcomes in terms of the number of people we've assisted, the work that our navigators do, the work of our community health workers, truly in an effort to bring more awareness CareNet just completed a strategic plan with a 3 to 5 year goals being set. And part of that strategic plan included some community stakeholder interviews. And in some of those interviews, people viewed CareNet as insurance. We're clearly not insurance. We're not reimbursing any providers or entities for services provided. Part of that is the Charity Care Network. We are fortunate with our collaborations and our partners, especially with the hospitals, because they write charges off for our members. So I get how people would think we're insurance. Another key takeaway with that is CareNet is very similar to CareSource. And CareSource is a Medicaid managed care plan and an insurance company. So, we just want to make sure that our community was aware that we're still here and really highlight the way that CareNet has continued to change throughout the years to meet those new identified needs. Started off with those that were low income and uninsured. And in 2015, we morphed a little bit to meet in 2013, we morphed when Ohio Association of Food Banks reached out and we became a navigator entity. Well, then we morphed again in 2015 because there was a new need and new cracks and that people didn't know how to navigate that healthcare system like we talked about. So that's when we brought on our community health workers. So that's what Wednesday's event was all about. Gave individuals, a one pager on the information. I'd be more than happy to share that with all of you. And just asked for, if they had new ideas of how CareNet and their organization could potentially partner, to let us know that.
And I'll toot Julie's horn about how much, how great the work is that CareNet's doing. She was sharing with me that people from JD Vance's office came up to see the relaunch. So it's recognized, the work is being recognized statewide of the good work that CareNet does and how they connect people to the resources they need. So it's a great organization to help those individuals.
Thank you for that. I love the little added kudos, and whenever I have the opportunity to sing the praises of our team, that's what I want to do. And so the relaunch gave us the opportunity to really kind of shine the light on our navigators and CHWs that are doing the work day in and day out.
Hey, I applaud Jack Ford for taking the steps to address the problem in the first place.
Yeah.
Exactly. It's in a world where things are oftentimes so political. CareNet's like the greatest sandbox in the world because everybody comes to the playground and plays nice with each other. We're just incredibly fortunate.
As they should. I have a firm belief that healthcare is a right, not a privilege. And I think for many people, healthcare feels like it's a privilege when you can't afford it.
Yeah.
Absolutely.
Okay. Anything else? Any other questions, Carrie?
No, I think we covered all that I had, so I think we're good.
Thank you, Julie. We appreciate your time.
Thank you.
Really.
Yeah, thank you for inviting me and giving me the opportunity to share a little bit more about CareNet. I appreciate it.